Obviously, I was generous with Dr. Menarez. If and when HHS officials come, I'll be equally generous with them. And by the way, I had said publicly that we would swear in the witnesses, but that would have required consent of the minority, and the minority did not agree to that. So,
If I,
please.
that is, when Secretary Kennedy came before us, he was not sworn in. To the best of my knowledge, no person ever before the Health Committee has ever been sworn in.
Which would have required unanimous consent, and it's certainly the right of the minority to object to that, and he did. So, Susan?
I would ask unanimous consent that the witnesses for this hearing and the subsequent hearing be sworn in.
Unanimous consent motion has been made. Is there an objection?
Chairman Cassidy, I object to the request to waive our committee rules. We did not swear in Secretary Kennedy. He appeared before this committee on 2 occasions, and to change the rules right now in a highly politicized moment seems to me to be extremely unfair to Dr. Menarez and Dr. Howry.
But she is suggesting that we would do it for the HHS officials that came.
We have not done it. I think it is unfair. You did not swear in Kennedy on 2 occasions. I don't think you changed the rules right now.
Okay. I will note that it's against the law to lie to Congress anyway.
That's right.
And so, but I do think putting people under oath sometimes makes them more believable.
And
but
we can discuss that for future hearings and maybe go along with that, but not right now.
Okay. Dr. Menarez, I just entered into the record the op-ed from the Secretary and your report, and both of those suggest that you and Secretary Kennedy were actually pretty aligned upon CDC priorities. How many times did you meet with the Secretary in your 29 days? Be brief, I've got 5 minutes.
I met with him when he swore me in.
Are you on?
Yes, can you hear me? I met with him twice. When he swore me in, he was in the room, he swore me in. And then I met him again on August 11th when he came down to tour the buildings that had been under the gunfire. And we chatted briefly.
And then you met the 25th as well?
And then the 25th, that's correct, yes.
Okay, and how many meetings were during around the period of the 25th?
We had 3 distinct meetings that day.
Okay, and what did he tell you to do?
In the
On the
first
25th? Yeah.
Briefly, in the first meeting, he asked me to commit to firing scientists or resign. He asked me to pre-commit to signing off on each and one of the forthcoming ACIP recommendations, regardless of whether or not there was scientific evidence.
And what were those recommendations? Did you have a foreshadowing of what they would be?
I did not. We did not get into any substance
But
about what those.
he wanted you to approve them.
He just wanted blanket approval.
Okay.
And if I could not commit to approval of each and every one of the recommendations that would be forthcoming, I needed to resign. I did not resign, and that is when he told me he had already spoken to the White House about having me removed.
Did he ever communicate he was going to change the childhood vaccination schedule?
Not until that very day. In that morning meeting, he said that the childhood vaccine schedule would be changing starting in September, and I needed to be on board with it.
Did he ever suggest that that he was speaking for the president?
In that morning meeting, he did say that he had spoken to the president. He spoke to the president every day about changing the childhood vaccine schedule.
Okay. Did Secretary Kennedy ask you to speak to anybody outside of HHS?
He did. In the second meeting that day, he indicated that one of his colleagues or collaborators, I don't know what the relationship is, was coming into town the following week, and he wanted me to meet with that person.
Who was that person?
The person was named Aaron Siri.
Aaron Siri, is he the trial attorney who wanted to get rid of the polio vaccine, allegedly, and President Trump slapped him down and said he couldn't do that? Is that the same Aaron Siri?
I don't know the second part of that, but I do know that there were public reports that he is the individual who had suggested getting rid of the polio vaccine.
Okay. Now, Secretary Kennedy told the Finance Committee that he did not ask you to pre-approve, but that you were biased against the new ACIP, and he just asked you to keep an open mind. Did he cite any data or science as relates to the potential ACIP recommendations to persuade you to support them?
He did not have any data or science to point to. As a matter of fact, we got into an exchange where I had suggested that I would be open to changing childhood vaccine schedules if the evidence or science were supportive. And he responded that there was no science or evidence associated with the childhood vaccine schedule. And he elaborated that CDC had never collected the science or the data to make it available related to the safety and efficacy.
To be clear, he said there was not science or data, but that you still expected you to change the schedule.
Correct.
Okay. Dr. Oury, Dr. Menarez has just said the secretary directed her to accept vaccine recommendations without seeing them and for which there is no science. Related to tomorrow's ACIP meeting, who decided what would be on the agenda?
So I don't have great visibility into that. I know the senior advisor and HHS counselor worked with our staff and the designated federal official and proposed items.
Okay. And who is the senior counselor?
The senior advisor is Stuart Burns, and the HHS counselor is Ren Archer.
And those are political appointees answerable to the secretary?
Yes.
Is that the way does normally the cabinet secretary or political staff set the agenda for a scientific meeting?
Not for the past decade. I was at CDC.
So this is the first time that's been the case?
Yes.
And in preparing materials for the meeting, were you told to disregard science or to enhance science, or what were you supposed to do?
For the last meeting, we had developed.
I'm talking about this meeting coming up.
So for this meeting, we didn't have work groups other than one for COVID. So CDC scientists were being asked by ACIP to develop questions and recommendations. I did suggest additional questions that the hepatitis B work group look at so that they could look at differences in age groups. The senior advisor was concerned that could bias moving away from a birth dose. I asked how asking questions and providing data could do bias if we didn't have the answers yet.
Biased against moving away from, you're suggesting that they wanted to move away from the birth dose, but they were afraid that your data would say that they should retain it?
Correct.
That's okay. Senator Sanders.
Thank you, Mr. Chairman. Dr. Menarez, at a September 4th hearing in the Finance Committee, Secretary Kennedy called you a liar for stating that you were fired because you refused to pre-approve vaccine recommendations. Is that accurate? Are you a liar?
That is not accurate.
Why did you believe it was so important for you to refuse to rubber stamp vaccine recommendations without seeing them or the evidence behind them? What did you fear was the worst-case scenario if you had agreed to doing that?
I refuse to do it because I have built a career on scientific integrity. And my worst fear was that I would then be in a position of approving something that would reduce access of life-saving vaccines to children and others who need them.
Okay. Dr. Menarez, the American Medical Association, the largest physician group in America, 270,000 physicians. The American Academy of Pediatrics, over 67,000 pediatricians. The American Academy of Family Physicians, representing over 125,000 doctors. The American Osteopathic Association, representing over 200,000 doctors. And the American College of Physicians, representing over 160,000 doctors. They believe that vaccines are safe and effective. Do you agree with them?
I do.
And what is your concern? What are the long-term implications for the well-being of our kids and the future of our country if faith in vaccine science is undermined?
I believe preventable diseases will return. And I believe that we will have our children harmed for things that we know they do not need to be harmed by. Polio, measles, diphtheria, whooping cough. I worry about the ramifications for those children in illness and in death. I worry about our school systems. I worry about our medical institutions having to take care of sick kids that could have been prevented by effective and safe vaccines. I worry about the future of trust in public health.
Would you agree with me in suggesting that the overwhelming body of scientific and medical thought believes that vaccines have been a major public health advance for the people of this world?
I absolutely agree with that.
Okay. Dr. Howery, during your testimony, you talked about fears for the future. Several years ago, as everybody in this country knows, we went through a terrible pandemic, worldwide pandemic. We lost over 1 million people. What are the, if trust in vaccines is diminished, if moms do not take their kids in to get vaccines, older people don't get vaccines, what will that mean in terms of our ability to save lives if, God forbid, another pandemic takes place?
So we're already beginning to see that as we're seeing childhood vaccination rates decrease. For example, measles is down to about 92.8%. That leaves over 200,000 kids now at risk for measles. So we are at risk for measles outbreaks. And for the next type of pandemic, a novel pathogen, with some of the staff cuts we have faced, we have less ready responders, we have less visibility into global pathogens at this time as well.
What would have happened to our country, and in fact the world, if, and I don't agree with President Trump very often, God knows, but if we had not developed warp speed and developed that COVID vaccine, did that, in your view, save millions of lives?
Operation Warp Speed absolutely saved millions of lives and was such a godsend for our country.
And if we don't have the capability to do that in the future, the implications will be?
We won't be able to have vaccines to save lives and protect people. We won't have that technology development. We won't have that platform, and we won't have people willing to accept vaccines.
And that will impact not only our country, but people throughout the entire world.
Absolutely.
Okay.